Morning, everybody. My name is Jennifer Clark, and I apologize I couldn't be with you today. But Marcia asked that I provide you maybe an overview of what's happened in the United States to render us in the healthcare crisis that we're currently in. These slides and some of the information I'm going to be sharing with you it has been done through the University of Tulsa's Institute for Healthcare Science Delivery that's run by Jeff Alderman, as well as Laura Ross White, and those of us who are faculty. Hopefully our studies and what we've been able to put together will give you kind of a foundation with which the rest of the conversations of the day can be laid upon, and perhaps inspire you to be a community member that takes back its health, because frankly, that's what's been lost. So I appreciate your time, and hopefully some of these insights will help you to help us make a better world. So, you've really got to start with how we define health. So if you will entertain me for a few minutes and just maybe sit and kind of close your eyes, or maybe just kind of focus your gaze a little bit down so that you're kind of inwardly thinking, and ask yourself a couple questions. One, what does it feel like to be ill? What are the experiences you've had about being sick? Once you've got that in your mind, ask the question of what it feels like to be well. What does it feel like to be healthy? Not how anybody else has defined it for you, but your own personal experience of when you remember health in your life. Now, thirdly, maybe a little bit more poking at you a little bit. Do you ever recall a time in your life where you felt bright or vibrant or your best self? Keep those things in mind today as you start walking through this, not only for yourself, but for those who you are trying to serve. Because I will tell you, you probably found it very easy to describe the qualities of being ill. You may have answered the question about what it's like to be healthy when you weren't taking any medications or you weren't suffering of anything. But really, do you want to define health that way? And I would guess that most of you struggled with thinking about a time where you were in flow and you were your best self. And I will tell you that's probably where our problem lies most. It was really interesting. The World Health Organization came out with this definition of health: a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. Please note the date on this. This was back in 1948. I can tell you the current unwritten definition of health in the United States is the absence of disease. Because frankly, you can't enter our quote-unquote healthcare system unless you are sick. So we don't have a healthcare system. We have a sick care system. So, really starting to think as you're developing community-based services, and we'll get to more of that definition here in a second, you have to know what health really is. There's actually a new study out called salutogenesis. So in medicine, we talk about pathogenesis, which is the formation of disease. But salutogenesis, which is a new term, is the study of health. And what we know is that they kind of fall into these four buckets. There's obviously the physical health that we have. We also talk about the mental health that we have in the use of the mind. But then there is the interconnectedness, the social stability and economic stability, or the exercise of our personhood, both the physical and mental personhood, in our social circumstances. And most importantly, and something we don't talk about very often, is the exercise of purpose and bringing meaning into our life. Because I will tell you, as a hospice and palliative medicine physician, this is where the most suffering occurs in our society. So to ignore it as an element of health is like cutting off a limb. So really start thinking about and researching how we define health. So what happened? How do we go in 1948 really knowing these elements of health to where we are today? Well, we had two major things occur. We had a massive social reform occurred. Post-World War II and the GI Bill moved our higher education and adult onset behaviors or adulthood to much later in life. With higher education, people became educated and became more aware of the exercise of one's self. The American dream really came into fruition after the World War II. And really engendered the autonomous assertion, kind of individual as king in the 1960s and 70s, and the major changes that happened not only in the United States, but also across the world, that then bled way into the 80s greed culture. So you have this underpinning of massive kind of anthropological, evolutionary, and social change that's occurring. At the same time, we've had the most massive growth of medical technology to date. It's the biggest growth in the last 100 years, but definitely in human history. Everything that y'all take for granted now has happened, even in my own training. HIV was a killer. It was a death sentence and is now a chronic disease. X-rays gave way to CT scans and MRIs. We now have cardiac procedures and neurologic procedures that don't require us cutting open things, but just inserting a catheter through the vein. I mean, all these major things that are part of our technology didn't even exist. And as a result, our ethics didn't catch up. What these two overarching themes, kind of propagated was this massive paradigm shift. That back in the 30s and 40s, as a physician particularly, but just in healthcare in general, and that we were a vocation, we were a practice, it was a calling for us. We were very similar to the town priest in that we served the population with which we lived in. And frankly, we didn't have a whole lot to do. We went in and listened to people's stories, bared witness to their suffering, and often just held their hand. We may have had a smidgen of antibiotics and a little bit of surgery, but what we could do was just be there. That shifted rapidly to a place where we had all this technology. It became a massive system that was really engendered by making money off of people's illness and death, frankly. And we shifted from a world of paternalism, where you kind of did what the doctor said, but the doctor was much more of a compassionate, bedside, knew your family kind of guy, to one of being a cog in a wheel. Kind of the whole make the donuts manufacturing process that we've been in that has frankly broken us not only financially, but also physically, mentally, and socially. What you're seeing now is the shift moving back to a world of shared decision making, where just because we can doesn't necessarily mean we should. And we are shifting the focus of healthcare away from the presence of disease toward a person-centered model that incorporates all this other kind of elements of health that have nothing to do with being sick. What are the other elements of being healthy? And it's everything we've talked about. It's the social determinants. It's all the things that contribute to our physical, mental, social, and meaningful well-being that we've not taken into consideration in healthcare. Okay, what are the social determinants? And it's been really interesting to kind of see how this part of medicine has really, again, shifted that pendulum back to this model again. Well, it started back in 2007 with this initial study. And of course, we look at from the lens of premature death. And what contributes to premature death? Well, it's social and environmental factors, healthcare, just access to healthcare, genetics, and individual behavior being the largest part of things. And it really started this conversation. Schroeder's paper in JAMA really started, actually it was in the New England Journal, started this whole conversation about, well, what are these really social determinants? And it's actually now much more clear. We've studied it over and over again across the world and in the United States. And what we do know is that as healthcare providers and our sick care system, our rescue care system only plays a very small part of people's health. 55% is all about social conditions, where they live, what happens, who surrounds them. 30% is their behavior, how they live on a day-to-day basis. And that's heavily influenced by that 55%. A very small part of our health is about genetics, because most of our genetics is all about the behavior that we induce to trigger those bad cancer genes or what have you. There's a very, very small part of our genome that if you have a gene that says you're going to get a disease, that actually happens. Examples of that would be like Huntington's disease, where it's a disease where you just, kind of a neurologic disease that if you've got the gene, you've got the gene. Breast cancer, in its most extreme versions of the BRCA gene, is almost a guarantee of disease. But that's so small, very, very, very small part of our makeup. And so when we start looking at this, we've got to say, well, where did we go wrong in the United States? How did we get so messed up? And why didn't other Western nations suffering as we are? So before we get to that, let's look at the elements that are really make up, kind of what leads to the social determinants contributing to someone's health. So as you guys are intimately familiar with reading your bios, that social and economic instability, when we look at, if you have never heard of Maslow's hierarchy of need, if someone's basic fundamental needs of food, water, and shelter aren't met, how are we going to talk about self-actualization, love, and belonging, right? That meaning making and purpose if you're just trying to find your next meal. So poverty and food insecurity, as we see in North Tulsa, contributes significantly to someone's health. Social isolation and discrimination, low occupational statuses, personal and community safety. You can't walk outside and get exposure to nature, which is a big part of healthy behaviors, because you're afraid you're getting shot or hurt. Obviously, poor housing, anything from food, kind of preserving and refrigeration, air conditioning, heating, water, electricity, whatever it happens to be. And then, transportation. These are all things that when we look at the disparities that we have and the contributions of social situations to someone's health, this is what we're dealing with. The other element that we have in Oklahoma, and many of you may have heard the Lewin report, is about behavioral health. How do serious mental illness contribute to our society's ability to help our population be healthy? Well, if we're robbed of our mental capacity, everything else kind of goes away. You couple that with social instability, and it's a massive chaotic storm. You can see the statistics here. People who have serious mental illness have a less life expectancy because we don't have the mechanics to care for people appropriately within our healthcare system. There's stigma associated with it. And then one piece I want to spend some time on is adverse childhood experiences. Some more information. Our mental health and primary care practices don't correlate together. They're fractured, and there's no integrative model. And so, we separate this mental illness from our healthcare system. Again, we have mental health providers, but they're so fractionated and don't give access to the people who suffer from serious mental illness themselves. So like I said, adverse childhood experiences, the ACEs study was something that really pushed even further this concept of the social determinants of health, that children born into certain circumstances are likely to develop chronic disease and early death. And so you can see kind of the building of these problems. So early intervention, like the BEST program with GKFF, are programs that really address this issue of, kids can't help the families that they're born into, but how do we help them grow in such a way that their circumstances, alone don't contribute to them to having an early death. So like I said, we've got to add unhealthy childhood experiences and the exposure to trauma early in childhood as those socioeconomic instability factors. So, many of you may have run into this situation where, oh my gosh, this person in front of me, they have their circumstances. What can we do? What do you notice? One of my privileges as a hospice and palliative medicine physician is I get to see people in their homes. I get to do house calls, like old school. And I will tell you, there is nothing more impactful as a physician to see the circumstances that someone lives in. If you are a social entrepreneur, you need to go where you're serving people. You need to go and see what life is like so that you can appropriately experience and understand the circumstances that you're trying to better. So I'm just going to lay out some ideas for you all with regards to, as we kind of shift this idea that if we are moving health into the center of a community and out of the healthcare systems, we really need to talk about what are the, how do the social determinants of health play into it so that we can build social and community-based services outside of the healthcare system that then only connects to the healthcare system when actually really needed. So as you can see here, all the things that we've talked about are, kind of this circle, and we need to break them where we can. Discrimination and racism kind of comes into play, leading to the social isolation, the mental health that we talked about in the childhood events. And then we need to talk about local, state, and federal policies that really start talking about breaking this cycle. But as an individual, we need to start teaching our children and our patients and our clients about resilience and coordinating the opportunities within our community where people can exercise their meaning and purpose so they can get their basic fundamental needs met. So those are the things, those pieces are the things that I ask you to think about. How do we break this cycle? Well, it's really interesting. I'm going to share a little bit of data, especially around the policy and local and state, maybe even federal discussion about other things that impact why we spend the way we spend. Dr. Deming was a, kind of amazing man. And so, in all those, in God we trust, but everybody else must bring data. So I'm going to give you some data to kind of chew on. So this is from the OECD, which is, kind of a conglomeration of all these kind of developed countries on kind of how do we, kind of better address spending. And as you can see here, the United States blows everyone out of the water with regards to healthcare spending per capita. And I can tell you, this graph is essentially flipped with regards to how outcomes. We spend the most and have the worst outcomes. We're way down on the scale with regards to healthcare outcomes. The only place where we succeed is in trauma. If you have an easily managed, kind of traumatic injury, heart attack, or an infection, we're really good at that. But every other element of healthcare, we are not. So the money that we're spending isn't gaining us any life, and actually is frankly causing us early and premature death. So if we're talking about social determinants of health as being the solution, then let's go look and see what everybody else is doing. So, kind of some of the issues that we pointed out earlier are addressed in profound education investments. I don't need to talk about that in Oklahoma, given what we've just lived through with our teacher strike. Housing assistance, prolonged maternity leave, child support that's state funded, long-term care, unemployment benefits, and old age pensions so that we can care for our aged outside of the hospital and allow them to thrive. So when we look at that, this is what we call the the American Healthcare Paradox, written by Elizabeth Bradley. Good book if you haven't read it. If you like watching videos, Escape Fire is a documentary that was made back in 2012 that would be really advantageous for you to listen and watch. It's about an hour and a half and packed full of all of this information that supports this data. Look at us. Ratio of social services to healthcare spending. This is the crux. For every dollar spent in OECD countries, there's $2 spent on social services, with the exception of the United States, where we are completely flipped, in that for every $1 we only spend 55 cents. Pretty interesting. This is another look at that in a different way. You can see the blue relative to the red. So, if not the government, then who pays for this stuff? How do we decide to change our values to put these first in the way we spend? And this is a summary kind of all of that, and something that maybe you can walk away with is, as Americans, we have a very narrow and some would say inverted concept of what it means to be healthy. Again, the absence of disease, right? The U.S. healthcare system has yet to integrate into itself our social and economic needs. Our communities have not demanded it. Maybe it's time that we rise up as people and take back our health. So, really, whose problem is it to solve? It's each one of us. Every one of us has got to decide what's important and what we define as health as. Again, these are the social determinants, kind of how does the healthcare delivery system really play into this? And over we're seeing that it's a community-based problems that draw into the healthcare system as needed. You will see this come up as you start looking into the solutions. This was brought out by the IHI, and they say that these are the elements that the healthcare system really needs to be looking at. One, population health. Population health is actually looking at a group of people, whether it be Native Americans or African Americans in a demographic area, or childhood, kind of certain ages, and really looking at what are we doing for those people? How do they experience healthcare? What are the costs associated with it? And something I'm going to bring up to you guys so that you are aware, because it's a mounting crisis, and for the physicians in the room, I know there are several of you, burnout is causing our healthcare system to break down even further. We're losing our physicians, our nurses, because they're getting burned out. And so the call is to bring joy back in to the practice of medicine again, so that we move back to somewhat of that vocational aspect. As Dr. Duffy, one of our former leaders in our community, and is still serving us and thinking, forward thinker of really turning back to being a humanistic professional again. So that quadruple aim of serving populations, understanding that healthcare needs to be more about maintaining someone's higher statuses of health versus continuing to rescue them. And then, eliminating the unnecessary costs that aren't providing us benefit. Shifting from a blame culture where people take responsibility of their health and we're here to serve, and not assuming that our patients are, non-adherent or, taking advantage of the system. We've got screening tools that are out there. We have wraparound social services that we know provide benefit. We have improved outcome. We have examples of those here in Tulsa, the Sooner Healthcare Access Network. There's housing programs that are out there that I'm sure Marcia can get you all hooked up with to see the things that we've done here in Tulsa. One of the most interesting things that we're in the midst of right now is that we've become an accountable, healthy community. It's a federally funded, nearly $5 million grant where we're finally tying our healthcare system into our social services and starting to integrate those things. And so there's lots of great stuff that are happening to really address these wonderful social determinant findings into expanding health and the responsibility of health into the community and out of the healthcare system. Again, our frontline staff and in the health system are too stretched. We really need to move things back into the community. So, there are tons of barriers that are out there, and a lot of it's just innovative thinking and thinking outside the box. And we found that people that are not part of the healthcare system, like yourselves, tend to come up with the better ideas. So really redefining, first and foremost, what health is and who's responsible for it. If the large majority of our health is in the social realm of health, then the community really needs to come together and say, what are we going to do to foster an environment where people can exercise their best judgment and behave in such a way that they can maintain physical and mental health and exercise their meaning and purpose. So with that, I will leave you to discussion. I know that you're going to be speaking with several of my colleagues and hopefully maybe sparking your interest and reclaiming our community's health. So thank you for what you do. I'm excited to hear your thoughts and hopefully be able to join you guys all in the future. Take care.